Hello and welcome to another important health awareness segment brought to you by DOC .Concall mobile application. Today we are going to speak about the importance of quarantine and self-isolation. Who requires this and how well we should do this. So COVID-19 is a novel coronavirus infection that began in the Hubei province 2019 December in China. It is now declared as a pandemic by the WHO. As we speak, in this situation, all the sectors of the society and the general public must support the government and the health authorities to make sure that we support best in terms of self-isolation and in quarantine to contain and to prevent the spread of this killer virus. Before I start, I need to emphasize on a few things. Coronavirus infection is a milder disease, a milder infection for most of the healthy people. Coronavirus is a serious viral infection. The healthcare authorities and the governments have taken it very seriously and they have put up many rules and regulations at the moment to prevent the spread of this virus. The real threat of this virus is to elderly people who have heart disease, lung disease and kidney disease, and those who are diabetes and those ill people who are on immunosuppressants like anti-cancer drugs. An infected person is contagious without being symptomatic for 4 to 5 days, and the incubation period of this virus is close to 14 days, and you can always spread the virus being asymptomatic on this duration. By the time the virus is detected, if you don't self-isolate yourself, if you don't quarantine yourself, it is likely that you have spread the virus to your surrounding. Like I said, COVID-19 is a respiratory virus, and when you cough and sneeze, if you don't take proper measures to cover your cough and to cover your sneeze, the virus can spread to a minimum distance of 1 to 2 meters. And in general, the virus is contagious on surfaces, and still no one knows how long the virus is infective on surfaces. But in general, we need to understand the virus can be alive for 8 to 12 hours on surfaces. That is why we need to frequently wash our hands if we touch certain surfaces. So what is self-isolation? Self-isolation is staying away from general public, avoiding going to schools and workplaces, and staying at home for minimum period of 14 days. And who should self-isolate themselves? Those are the people who have traveled to an infected area, and if you have fever and cough and cold, you need to self-isolate for 14 days. And if you are being in contact with a COVID-19 infected person, staying at one place for more than 15 minutes with 2 meters apart, you must self-isolate yourself. When you are in contact with a COVID-19 patient, the government and the health authorities use a process called contact tracing. And as general public, we must support contact tracing to make sure that all contagious patients, all people who have been in contact with a COVID-19 patient need to be quarantined. Now we are going to look at few steps to understand how we should self-isolate ourselves. Remember to restrict yourself to one room, and this room must be a well-ventilated room, and you should always keep your door closed. And remember not to go to common areas or shared places at your room, at your house, like the TV lobbies, the verandas, the kitchen. Use a bathroom separately. If you have only one bathroom in your home, try to be the last person to use the bathroom. Allow the other healthy people to use the bathroom first, and you need to go last. And also you need to make sure when you go out, before leaving the bathroom, to clean the bathroom with alcohol-based sensitizers or by chlorine or other form of bleach. Have a separate bathroom kit. Use your own towel, the soap, the toothbrush and the toothpaste need to be separate from the other people. Remember to wash your clothes separately. Have your food and medicine delivered to your doorstep and ask your caretakers to leave it there. Remember to use hot water and hot meals as much as possible during these 14 days. Keep extra garbage bags, and when you dispose the sneeze clothes or towels, make sure that you double bag and ask your caretakers to burn them. Remember, you should not allow any visitors to come to your room. If you are sick, having fever, cough and cold, don't visit your doctor immediately and wait in the waiting areas, which will increase the risk of spread of the virus. Always call your doctor and make an appointment so that the doctor can see you in person, or else use the .Concall mobile application to consult a doctor online. the doctors will guide you on a personal note and help you how to proceed with the problem you have. And if you need to meet your family members, always try to do that through your cell phone. But if you need to see them in person, always wear a mask and maintain a 2 meters distance when you speak to them. Remember, we all are in this together. There's no shame and no stigma. We need to help each other out on this. Don't allow your fear and the anxiety get over your knowledge. Stay informed and stay compassionate, and I'm sure that we can get through this in time. Thank you so much for watching this video, and excellent resources on this include WHO website, the World Health Organization website, the Center for Disease Control, the CDC website, and also you can always get more information about the Sri Lankan local updates on the Epidemiology Department website. And if you have not yet subscribed us, make sure that you subscribe and leave a comment below so that we can make useful videos like this in the future.